As I finish up the semester, I realize I have learned a lot in just a few months of nursing school. I learned many of valuable techniques involved with physical care. However, this semester taught me that there is much more to being a nurse rather than using physical care techniques and learning more about them. Being the best nurse I can be requires me to identify a role of professionalism. This means that I have to be aware of my responsibilities and be able to have a sense of independence so that my character is assertive and compassionate. I will be professional by completing all my tasks and not expect a nurse from the next shift to finish for me. I will interact with my coworkers in an understanding manner and remain true to values so that I do not get taken advantage of. Being professional also means that I have to be aware of the rules around me. By this, I mean it is my task to be up to date with the latest changes in healthcare policy and legislation and stay true to it. Lastly, as a nurse, I will be in tune with the concerns and needs of my patients and make it my main goal for them to achieve their maximum state of health. For example, if I catch a coworker not following protocol for the patient's safety, it is my job to make sure that it is not ignored and reinforce proper care. From there, I plan to install these changes into my professional character in the workplace in order to maintain a safe and flourishing environment. Communication is something of extreme importance in the nursing field. It is a source so powerful it has the potential to save lives, which is why it is my job to make sure the process of communication is carried out smoothly and effectively. I have to be an active listener. When talking to a patient, I need to be ready to understand what they are trying to say and empathize with them. I need to make sure that I am translating all the material I am receiving accurately and paraphrase it back. When patients come from a different background than my own, it is crucial for me to have no judgment towards them and to make sure that I am providing them with an environment that respects surroundings. When patients and family are upset and confused, I can try my best to calm the situation and immediately take action in every way needed so that my patients are content. I also need to relay information correctly when it is necessary. This can involve me being the mediator in a tense situation and requires me to establish or repair harmonious environments. I cannot be afraid to inform the doctor about patient needs even if time is of the inconvenience. For example, if a patient's status has significantly changed to the point of concern, I need to call the doctor and stress the need for his or her intervention, even if they do not feel the same. Given all that I have learned and all that I will learn at Indiana University, I plan to carry out these lessons into my future career as a nurse. I will remember to maintain an honest and professional relationship with my peers and patients currently and continue to do so. As a Type 3 personality on the Enneagram distinction, I am aware of my strengths and weaknesses, and I can keep these in mind throughout my life. I understand that I am goal-oriented and strive to achieve in order to impress others. But I also am aware that I cannot let my fear of being rejected or ignored hold me back, for that can impact my responsibilities towards effective communication. Within the OB unit, I can apply the skills I learned in SimLab and the guidance from my professors. Simulation and clinical practices also allow me to use polite and flowing communication skills, whether it is with my fellow peers or any person of higher authority. Because nursing education never truly ends, I will take continuing education classes in order to uphold my character as a respectable qualified nurse. And of course, I will remember to implement all the core components that make up my job: an advocate, an educator, a hardworking professional, a nurse.